I'm going to check my chart, wash my hands. Hi, I'm Jennifer. I'm your nurse today. Can you tell me your name and date of birth? Okay, Nick Taylor, 1/1/1950. Okay, so I'm going to be doing a head to toe assessment on you. Do you have any questions for me? No? Okay. First, I would want to check vital signs. So I want to check the temperature, the pulse, respirations, blood pressure, and pulse ox, and then also see if he's having any pain. So are you having any pain today? No? Great. Okay. I'm going to gather up my supplies and I want to clean my stethoscope. So I want to clean that. Grab my pen light. And then, so can you tell me where you are today? You're in the hospital. And do you know the date or the year even? Yep, it's 2025. Yes, it's July. That's correct. And do you know why you're here? Okay, so you're going to have, you had some surgery. Okay, great. Then as I'm talking to him, I can see that his speech is clear. He's able to answer my questions appropriately. He's alert and oriented ×4. Then I can also find out about any other problems with vision or hearing. So do you have any problems with your vision or wear glasses or contacts? No. What about hearing aids? Wear hearing aids or have any difficulty hearing? No? Okay, good. Are you able to swallow okay so you can eat and drink without any problems? Okay, great. So no difficulty with swallowing, no problems with hearing or vision. And next thing, I'm gonna just have him. I'm gonna pull out my pen light. Just look straight ahead, and I'm gonna shine this light in your eyes. Okay, and kind of bright in here. So I'm gonna shade some of the light. I'm going to shine this light in your eyes, okay? And both pupils are equal, round, and reactive to light. Then go ahead and just keep watching this pen light as I bring it closer to you. All right, so both pupils constrict, so they accommodate. So that's Perla. And then next thing, I want to go move on down as I'm doing my assessment. So I'm going to go ahead. I already cleaned off my stethoscope. So I'm going to start with the respiratory assessment. So do you mind if I pull this gown down? All right, great. So I want to listen. When I did my vital signs, I already got the respiratory rate in the rhythm. So the rate was 17 and regular, no difficulties breathing. And then I'm going to go ahead and listen as I move my stethoscope. I want you to take a breath in and out, and I'm going to compare side to side. So I'm going to listen to a few places in the front. Just breathe in and out. Okay. Lungs sound clear. Great. Breathe in and out. Great. All right. And then I can listen to the sides. Great. And then for the back, can you sit up here for me? I'll help you up. Sit up there. And then I want to listen in the back and I'm doing the same thing, comparing side to side. So breathe in and out for me. In and out. Okay, great. In and out. Great. Okay. Lungs sound clear. Then I'm going to listen to the heart. So I want to listen to the different landmarks. I'm going to start in the aortic area, pulmonic, Erb's point, tricuspid, and then mitral or the PMI. That's where I would listen for the apical pulse for 1 minute. I don't hear any abnormal sounds, and the rate is 72 and regular rhythm. Okay, great. Then I'm going to go ahead while I have my stethoscope out, and go ahead and do my abdominal assessment. So first I want to inspect, and I'm looking for any scars, discoloration, incision, wounds, anything abnormal. I also want to look at the contour, the shape. So abdomen is flat, non-distended, and are you having any pain in your abdomen? No? Okay, so I'm going to listen in all 4 quadrants, starting with the right lower. I would listen, making sure I hear bowel sounds. Okay. I hear bowel sounds in all 4 quadrants. If I didn't hear bowel sounds, I would listen for 4 to 5 minutes. Next, I'm going to palpate the abdomen. So just checking again if he's having any pain. And as I press down, let me know if you have any discomfort, tenderness. No. Okay. No. Okay, great. So that's good. Then I'm going to go ahead and put this back on and continue with my assessment. So for my pulses, I want to make sure my patient has good blood flow. So I want to check the radial pulses, and I want to check them both at the same time. So I'm comparing, making sure that they're both equal and strong bilaterally, and they are, so that's good. Then I can do my dorsalis pedis. Again, they're equal, strong bilaterally, great. Good blood flow, okay. I can feel they're warm, dry. Color is normal for ethnicity, and then I can also check cap refill, and I do want to do the same thing. I do want to check on both sides, so I can do that at the same time. And same with the toes. Cap refills less than 2 to 3 seconds, so nice and brisk. And then I can also check for edema. So press, see if there's any edema. No edema noted, so that's great. Next thing, I want to check the strength. Okay, so he was able to move. I've seen him get up and he went to the bathroom. I've seen him move around, so he's got good range of motion. I have him squeeze both my hands, and again, I'm checking both sides because I want to make sure there's good strength bilaterally. And then with the feet, just push on both my hands. Press down like you're pressing a gas pedal. Good strength, they're equal both sides. And then I can have him just flex his feet towards him. So pull your feet towards you against my hands. And again, they're equal, strong bilaterally. So good strength, that's great. Next, I'm going to, I already saw that he got up and went to the bathroom, and he has a steady gait, no problems ambulating. He didn't require any assistive devices or anything. I want to make sure that I put him back the way so he's comfortable. Let me cover you back up here. Okay. Make sure you use your call light. I'll give you your call light. Okay. Make sure you call for help to get up. And then, do you have any questions for me? No questions. Great. Next thing, I want to do some patient teaching. So you can teach on whatever you want. I'm going to say my patient needs to be using his incentive spirometer. So I'm going to show you how to use this. You want to put this in your mouth, okay? Close your lips around it and inhale, okay? Take a deep breath, a slow deep breath. Try to hold it as long as you can and then slowly let it back out. Great. We want you to do that just like that 10 times every 1 to 2 hours while you're awake. So you don't have to get up in the middle of the night and do it, but this is going to help expand your lungs, prevent you from getting pneumonia, which we don't want. Okay. Any questions on that? No? Great. All right. So then after that, I would wash my hands again and open the curtain if I closed a curtain, and I would go out and document all of my findings.